Macular Society London Conference 2013. Helen Jackman, Chief Executive of the Macular Society. Welcome and introduction.
Well, welcome to the Macular Society's annual conference. My name's Helen Jackman. I'm Chief Executive of the Macular Society, and I'm absolutely delighted to see so many of you here today, lots of old friends and new, I hope. This year's conference is actually sold out, so well done to you for being so organised and getting your tickets nice and early. I just hope that we can live up to your expectations. And I want to give a special thanks to our conference sponsor, VisionAid, who've really helped us this year, so a big thanks to them, and do visit them in the exhibition. Now, I've got 10 very short minutes just to tell you a little bit about some of the work of the Society this year. And I wanted to start with a little bit of a reference to what's going on in the external world. There are lots of new and exciting and promising developments, but also a good deal of challenges that we're facing. The pace of scientific discovery and research has increased this year, as I hope is reflected in our annual journal digest. I'm sure many of you know that Eylea has now been approved as a treatment for wet AMD alongside Lucentis, and we're hoping that the fact that that drug offers the potential for fewer injections will help many patients and reduce the burden on eye clinics. Trials are also underway in a similar vein to combine anti-VEGF drugs like Lucentis and Eylea with radiation therapy. And again, the promise is that they could reduce the number of injections required. We'll hear more from that from Ms. Bailey later on. There's also been work going on this year from the Society and other organisations to make sure that Lucentis was approved for diabetic macular edema, for retinal vein occlusion, and we hope shortly for myopia. In the last few months, we've also heard interesting reports about the potential value of something called complement therapy as a possible treatment for dry AMD. And there's also lots of progress going on in terms of stem cell trials, which is extremely exciting. And trials are taking place now on a few people with Stargardt's and also, hopefully in December, on people with macular degeneration. And alongside of all of this, some of the new technologies that I referred to rather glibly earlier are offering real new promises for many visually impaired people. So wonderful things in terms of accessible technology with iPads and Kindles and all that kind of thing. Really, really revolutionising life for many people. Yet despite all of this, there are so many big challenges that we're facing. The number of people with macular degeneration is really on the increase. There were 500,000 people in 2010. And because of the fact that we're living in this ageing population we hear about so often, that means that by 2020, those numbers will increase by a third, up to 650,000 people. That's 70,000 people developing the condition each year. And that has a huge knock-on effect in terms of the services and treatments that are so effective for people. And we know that the eye clinics and the low vision services across the country are really struggling to cope with the sheer number of people that would benefit from support. We did a little survey last year, and it suggests that about half of the eye clinics really can't cope with the number of people needing injections and are not able to get that first injection for wet AMD within the guidelines recommended of 2 weeks. And about 80% of clinics are finding it very difficult to meet the recommended monthly guidance for follow-up. And that's despite the amazing efforts of many of the staff working in those clinics, but just the sheer numbers are placing a tremendous burden on those clinics and on the low vision services that we all need so much. I suppose in that context, it's fair to say that the work of the Society is even more important. We're seeing a huge increased demand for our services. Our helpline calls have doubled in the last 3 years. Our counselling sessions are up 30% on this time last year. We've launched 25 new groups, bringing the total to 275 across the country. And we've got more than 1,000 volunteers working to support people across the country. And we think that they touch the lives of about 10,000 people, from people supporting others to develop eccentric viewing training, to telephone befrienders, to a new role, daily living champions, demonstrating all sorts of amazing low vision aids and gadgets, high-tech and low-tech, to people across the country. With all this demand for our services, we urgently need some more volunteers. So I suppose I'm challenging you to think about whether that might be something that you could do. Because of your experience, many of you, with central vision loss and with a whole range of different professional and life skills, you could be an amazing volunteer for the Macular Society. So if you'd like to find out more, if you don't already do it, do talk to our volunteer stand that's out in the exhibition. The other area of our work that's grown in the last 12 months has been our research programme, and it really is going from strength to strength. This year, thanks to your generosity, we were able to increase the size of our grants to £170,000. And that brings the total that the Society's invested in research over the years to £2 million. We've got really ambitious targets for the future as well. We need to raise £1.5 million over the next 5 years to support the kind of quality projects that we're seeing. We're one of the few national charities committed to funding macular research, and our funding really does play an important role in helping to move projects on towards new treatments, and we hope one day that cure that we all want so badly. I'm delighted to announce that we've funded £365,000 worth of grants this year with your help. Just 2 examples. Researchers at the Institute of Ophthalmology, which is part of the University College London, are working on a new project which is looking at the way that light can optimise stem cells for transplantation. It's an amazing technology, and I was lucky enough to go to UCL and see behind the glass doors of this lab the work that they were doing. Really, really exciting work. Newcastle University is also developing a disease model for AMD, which we hope will help researchers understand the way that AMD progresses and hopefully help with some of these new research projects into stem cell therapy and so on. We've also been working on your behalf behind the scenes to try and help improve macular services and treatments. We're working hard with policymakers and commissioners to help them understand the urgent need for more investment in macular services. And last year, hundreds of you responded to our survey, for which we're very grateful, on the impact of something called Charles Bonnet syndrome. I'm sure many of you may be aware that sometimes when you have central vision loss, you experience visual hallucinations, things that aren't really there. And this is a perfectly normal side effect of central vision loss. But I think the impact of this has been underestimated, and our survey showed that 1 in 3 people actually find that these hallucinations have a negative impact on them. And so we're going to be working on a new campaign to raise awareness of the Charles Bonnet syndrome amongst health professionals and try and really educate them and encourage them to talk to their patients about the condition. We're also committed to ensuring that more people know we're here to help as an organisation. And so some of you might have noticed our new look and our new name, which we launched at the beginning of the year. This was really based on research with members and professionals and partner organisations. And what we learned from talking to hundreds of people, that you felt that we needed to modernise our look slightly, that we needed to reflect more warmth and dynamism in the way that we present ourselves. And overwhelmingly, we heard that people really disliked the word disease. Many people found it off-putting and overly medical and quite negative. So we decided to just simply drop it from our name. Alongside this, we launched a professional member scheme, and that was really designed to help encourage eye health professionals to refer people to the Society and to hand out our leaflets and patient information. And since February, we've recruited over 1,200 professional members to the Society, and we're really, really committed to trying to recruit more. So a little challenge for you today. On the fundraising table, which is out in the lobby, there are some little envelopes, and they enable you to give those to your eye health professional, whether that's an eye clinic liaison officer, an optician, an ophthalmologist, a rehab worker, just to encourage them to join the Society. As professional members, their joining is free, and that's because we want them to pass on our materials and refer people to the Society. So if you get a chance, do take one of those envelopes and just think about that as my challenge for you to pass that on to whoever supports you. As a result of the rebrand, we've noticed a huge increase in the number of leaflets and materials that we're distributing. So we've doubled already this year the number of leaflets that we've distributed to eye clinics and opticians since last year. And we've distributed nearly 500,000. That's 500,000 leaflets that we hope will provide really important information to patients across the country. Our traffic to our website, so people looking us up on the web, has gone up by almost 40%. And our new branding is helping us to unlock new partnerships with companies and organisations that we hope will help us reach more people. I hope that gives you a sense of just how much is going on in the Society. And I did just want to say that it's such a privilege to be involved in this organisation. It's such a vibrant and passionate community. I'm not just talking about the organisation and the staff, but you, our members, and our volunteers, and our trustees that all work so hard to support each other. Finally, I'd just like to express my thanks to our new, not so new, Chairman Richard Elliott. This time last year, Richard stepped into the very big shoes of Alan Alderman, who sadly died in July 2012. And after a year in post, I think it's fair to say that Richard can't really claim to be the new boy anymore, but he's more than earned his stripes, and he's done a mammoth road trip of the UK, visiting many of our local groups, and we're extremely lucky to have him. I'd just like to hand over to Richard to introduce our morning speakers. Thank you very much.